I always start our association update with a few statistics. These statistics are from year ending December 31st, 2023. They begin to demonstrate the very successful year that the CCSA team had as we work to anticipate and exceed our members' needs. While we gather and report on a variety of performance indicators, indicated on the slide is a sample of some of those key indicators. And you would have seen, if you read our annual report, you would have received these statistics throughout, although the annual report was a point in time to meet the WCB and OHS program services delivery timelines. These are up to date to December 31st. So I just want to highlight a couple of the successful statistics that we have. Of note, the official launch of our learning management system in 2023, as Tyla talked about in May of 2023, our training participation increased by 105% in 2023 over 2022. 99% of those who attend CCSA education say they would be able to apply what they learned to improve safety at their workplace. So we know that our training is effective. CCSA members who participate in the Certificate of Recognition program received a combined $2.3 million in core refunds. So over the last 3 to 4 years, we've been adjusting our support model to ensure that we're flexible, scalable, and sustainable. This is in part because our members are diverse and dynamic. They're large and small, they're rural and urban, they're private and not-for-profit. Therefore, the one-size-fits-all, classroom-based, training-focused approach does not work for all, nor is it a sustainable model. Instead, we have transitioned our support to scaffold our services to suit the breadth and need of our members' needs, allowing them to access and engage with us based on what their needs are at the time. Over the next several slides, my team and I will highlight key 2023 activities and projects in each of these key support areas, while providing a sneak peek at activities and projects that are already underway this year. So joining me today, I'm going to have Leanne Morkin, Director of Training, Delivery, and Member Engagement, Amy Fenton, Director of Partnerships and Innovation, and Jeffrey Smith, our Business Analyst, join me to talk about, to share some highlights from 2023 and talk about what's coming in 2024. So I'll hand it off to Leanne first.
Thanks, Dana. So back to scaffolding of our services to be flexible, scalable, and sustainable. Same goes for our education delivery model. Since the launch of our LMS, as everyone has mentioned, 3 courses successfully transitioned to our on-demand option, Health and Safety Committee and Representative Training. We had our Hazard Assessment and Control, and also Managing Violence, Harassment, and Responsive Behaviors. We will continue to offer our courses as virtual instructor-led options and have recently introduced public in-person training sessions for the Working Mind for employees throughout the province at various member sites. This model enables us to quickly scale our operations to meet our members' changing education and engagement needs with minimal impact to our services. This shift towards on-demand and blended learning options in 2024 signals CCSA's commitment to modernizing its educational approach by adapting courses to cater to various learning styles and preferences. CCSA aims to provide more flexibility and accessibility to its learners. The worksite inspection course will be converted to on-demand as an option, and portions of the auditor training and MIP theory will be adapted into a blended learning that will be available on the CCSA learning management system this year. This evolution in instructional methods not only keeps pace with the changing educational landscape, but also ensures that students can engage with the material in ways that best suits their individual needs. As CCSA continues to embrace innovation and flexibility in teaching methodologies, students can look forward to a more dynamic and personalized learning experience. experience in the years to come. I'm going to pass it off to you.
So as many of you have hopefully heard, seen the communications, the CCSA has partnered with AuditSoft this year. And as of February 26th, all audits will now be completed through the AuditSoft platform. There is no license fee or access fee to maintain access the license. So once you sign up, you register your audit with us and you go to get your license. As soon as you click on CCSA, you get it for free. So we just want to make sure that everybody's very clear that there is no cost, which is fantastic. This partnership will result in a more streamlined and quicker audit and QA process. And as I just mentioned, we still have the same process as before. So register your audit and then we'll say, great, thank you. Now please go ahead and access the tool or access or request the license for the tool. When it comes to AuditSoft versus CCSA and our processes, AuditSoft has the training. So AuditSoft will provide all the training on how to use the tool. That's not something we will be doing, but we will still support you in all the CCSA process part. But obviously, if you do have a question about anything, if it's technical, AuditSoft related, they've got a fantastic support system and solutions on their website. You can send them tickets, you can call them. If you're still not getting an answer, reach out to us, obviously, and we can reach out to our contacts there as well to get you the answers that you need. As for core modernization, so I think Miles gave a pretty good overview of what that's been looking like since 2018. So work is continuing on the CBSA, and the working group will be engaging with core holders and the auditors and employers, hopefully later on this year, all going well, and getting some feedback from you guys. So stay tuned for updates on the CBSA, and I'm going to hand it over to Jeff.
Okay. Hi, everybody. So when I joined the CCSA, I learned there was a lot of discussion around the core program between the members, the board of directors, leadership, all kinds of different discussions. Everybody really wanting to know, really, how is the core program performing for us? So Dana sat down with me one day and she says, Jeff, we should do a formal evaluation of the core program for the CCSA. And that's what we did. We actually designed it. We put it into two parts. We designed the evaluation. And in the first part, we asked three central questions. And the first question we asked is, do our core holders have lower injury rates than non-core holders? And what we did is we actually excluded COVID. We did this with and without COVID, but we took the COVID effect away because we knew it was a brutal impact on our sector. But we actually took away COVID and to the best of our abilities compared core holders versus non-core holders, took a battery of statistical tests. And at the end, for the last 7 years, what we can tell you consistently year over year, generally speaking, there's some bright spots, but generally speaking, core holders have more injuries than non-core holders. That caused a lot of conversations between Dana and myself and others later on. And I'm sure you're just processing this information if you're seeing this for the first time. The second question we asked in our evaluation is, do our core holders, and we did this for non-core holders too, are they demonstrating injury reduction? Because that's the whole purpose of the core program. The zenith is injury reduction. Once again, we did a whole bunch of analysis, did a bunch of statistical testing, and the answer was very simply no. There was no injury reduction occurring for our core holders. But if you look across Alberta, the injury rates have been rising in general for the same time period. So we were just following along in the same pattern as the rest of the province. In retrospect, we said, there were some significant things that happened back in 2017. New legislation was introduced, significant, I think Miles referenced that today, significant legislation around OHS and WCB. Yes?
That compares to other industries as well, the same correlation?
I only have access to our data, so we're looking at our own core holders. I couldn't tell you how other, yeah. What I can tell you, core versus non-core, and I have worked at the WCB for a great many years since the beginning of the core program, and I've worked 12 years at the government working with the same data, is that I haven't seen results like in our sector, but I haven't seen injury patterns, and everything is so unique with this sector. It's incredible. So I'm astounded. Like, and I was telling Miles that today after. So the simple question is, there was no injury reduction occurring. And the third question, oh, I'm good with data, not with Third question was, okay, how do core holders compare to non-core holders in the WCB pricing programs? So what I did is I not only looked at the PIR rebate, but I actually looked at the experience rating that all the companies go through. Some of us are in poor performance surcharges, and I looked at the industry rate, and I came up with a formula where I boiled it down to the simplest kind of visible analytic that I could figure out, but it encompassed all what was happening in the WCB pricing programs. And what we know is core holders have lower WCB premiums than non-core holders. And that's statistically credible. It's what we know, and it's what we expected to find. So core holders do better. So that was the part one of our project. We had a number of different recommendations, one of which was to move on to part two, and which I'm going to talk about in just 2 seconds here. And there was another set of recommendations on improving the program, continuing to evaluate the core program, and so forth. So part two, which was our number one recommendation, is we should do part two after doing part one. Our members invest a lot into the program. Now we know there's financial benefits from the WCB side. So what we want to do now is to look at the number one bullet point there is we did that analysis up until 2022. In a week or 2 or 3 weeks, I'll get the new data for 2023. We're going to update those results. So we'll look at core versus non-core for injury rates. What are the difference in premium benefits? I have sort of temporary information from WCB, and what it looks like is the injury rates are getting closer together, and it looks like the premium are expanding, and core holders are continuing to even get better premium advantages. So that's kind of like an early insight. What we want to do though is we want to say that everybody is investing in this program. Everybody is setting up a health and safety program, but that's legally required. What is unique about the core programs, you invest in that audit process. So what we want to do is find out what is the time and costs of going through that annual audit process. And then we want to compare that investment that you make with all the audit process and compare it to the premium benefits that you're experiencing. And then what we'll get is what we call a return on investment of the program. How are we going to do that? What we've done is we've created a customized survey. So anybody that was a core holder in 2023, we're going to reach out to you. And I've already started this process this week. I've reached out to a couple of you. And the survey is very, it's designed to your individual audit experience in 2023. And what we've also done is we've assembled all the training records. Anyone who took training related to core auditing in 2023, there'll be a list there. And we're going to reach out to you, and we're going to ask you, are these records correct for your training records? And then we're going to also ask you about specific questions on the audit process, depending on which type you went through. And then when we're done that, we're going to gather all that information to find out how much time people are spending on the audit process, how much financial costs, and then compare the two. In that process, I'll be there to coach people through. So there's approximately 50 different audits occurring. I'll reach out to 50 different organizations, make that contact, myself. I'll make myself available to you. I've got a survey guide that explains what what information we're trying to collect. So it's never been done before, so it's going to be a new experience for us all. Oh, once again.
It's okay.
In the end, what we'll get is we'll know at a global level across all of our sector, how much time, effort, investments we're making into the audit process. We'll also know what those financial benefits are through the WCB pricing programs. We'll also be able to look at different industries. So we'll look at senior supportive living, we'll look at continuing care. How are they doing individually? All this information will be gathered. It'll be kept strictly confidential at Continuing Care Safety Association, but we would be able to have one-on-one discussions with you. If you decide to participate in the survey, it's voluntary. We can sit down and we can go over your individual results. Here's what you invested in the program. Here's what you're getting out of that in the WCP pricing programs. And then we'll also do that update of 2023 results, and we'll also share that with you in that final report so that we produce. Thank you. Okay. So the timelines for this start this week. We started the actual survey process. It's very delicate. I see this going into May. And then I'll get the new information from WCB on the injury and the premium information. So we'll update that in April also. What we'd like to do is actually work on this in April and May, and then come out with a report in June, and then where we can share the results with everybody, and then the evaluations will lead to good discussions of where we go next. So now I know I gave you a lot. So anyone has any questions on the study, the survey, just reach out, contact me. I'm really, really happy and wanting to have any kind of discussion around it. So.
Lauren.
I just have a comment. What I appreciate what that is for value add.
Yeah, thanks, Lauren.
Yeah, my only comment to that is it's in the bigger paper, but these are direct WCB benefits. We all know there's greater benefits of implementing health and safety. So there's so many other benefits, indirect benefits to speak of. So
Is the survey tool completed?
the survey tool is completed. Yeah.
The company for some virtual sessions for presentations like that organizations can sign up to just for that ease of completion.
I'm not sure I understand the question. So
If you think like if the survey tool is quite nuanced and it's going to take some struggles to get, we want good data.
yes,
Right?
yes.
So is there an opportunity for us to host?
Oh,
you know,
absolutely. I would
host the virtual session?
I would absolutely take you up on that. Yeah. I think the more direct conversations we have, even me, like reaching out to different organizations, I expect I will learn. I'm going to miss things in the survey guide. Like, oh, I didn't account for that. These people are actually doing this kind of work and I didn't list it out. But absolutely, I would take you up on that in a second.
Like, organization basis, or is maybe something we'll consider and throw out for some dates?
We'll take that away, Kim. The survey that Jeff is doing is he's reaching out to organizations individually and walking through the survey with them. So
My hesitation as an organization is that he can get 15 different
answer.
interpretations.
Yes.
I thought of that. Yeah. Yeah. And that's why I'm going to sit down each time with the key contact and say, what's the best way to gather this information, make sure it's uniform across all the 50 different responses.
Yeah.
Won't be
Okay.
perfect, but we'll do the best we can.
We'll take that away, Kim. Thanks. Good suggestion.
A quick question about your data information at the beginning. Does CCSA get any access to industry specific information like the CMIs? When we're looking at we in our industry, we're seeing an increase in our injuries, but as operators, we're seeing an increase in the acuity of the residents that we're caring for, which I think is a contributing factor. And I'm curious if CCSA has access to that. Operators, we don't.
We have access to the WCB data. We get a quarterly, we get that data on a quarterly basis. But we don't get access to the CMI data.
One of the things that the CMI data, when we did analysis, is that the CMI data doesn't do a good job of capturing our residents with dementia. Agreed.
So at the lower CMI versus our bariatric presence that might trigger a higher rating, and actually contribute to some of the musculoskeletal injuries, right? As opposed to, the different injuries that are recognized to our residents.
And that's where I was going with that as an industry. If we could find another ally to advocate the change of the CMI, CCSA rates, advocate, if we could correlate the injury rates to the need to change, I was going to use a naughty word. And the way that the NBS RI has done, that would be,
Well, I think that's on the cusp of happening, so maybe we'll be able to,
Yep, thank you.
thank you.
Any other questions? Or comments? Is there any online, Natalia?
Well, thank you for your time.
Thanks, Jeff. Okay, so moving on to promotion. So while we've always been focused on collaborating and sharing best practices with our members, in the 2022 member engagement survey, we heard that our members wanted CCSA to continue to grow opportunities to learn from each other and our partners across the country, as well as have easy access to a variety of resources to use with their teams. Promotional services build on employer and employee awareness of key industry-specific health and safety issues and shares information designed to support just-in-time leading workplace health and safety activities that support a positive health and safety culture. I'll highlight just a few of our solutions. We've got a number of them on the slide to help identify some of them. But as an example, safety segments are released every month. Members have a one-stop shop safety huddle toolbox talk resource that is more than just a piece of paper posted on the OHS bulletin board. And this year, what's new is every safety segment includes an emergency response code of the month, tabletop exercise, and facilitated discussion. So feel free to use those safety segments every month. They are communicated in our Health and Safety Minute newsletter. We have 3 newsletters, and sometimes I get the names mixed up. Our Health and Safety Minute newsletter, we share those in there, or you can also find that information on our website in the resource library. YouTube videos, we've been growing our YouTube library steadily over the past couple of years, both in video content and subscribers. We're pushing towards that 1,000 subscribers that we're trying to achieve for our YouTube channel. These videos complement the safety segments, as well as videos that can be used on the job body mechanics coaching, or learn about an OHS best practice, just to name 2 ways to use them. So again, another valuable resource that you can use in a variety of different ways to support you and your team on the job. OHS collaborative discussion forums. In collaboration with our industry association partners, each quarter we coordinate a presentation by experts on a health and safety topic. Our next forum is actually tomorrow afternoon, and it will feature the advisor's office for Alberta workers' compensation. So you can learn about that free service that's available to employers to help you with your WCB claims. And then lastly, it's not highlighted on the slide, but I did want to share the Health and Safety Star initiative that we launched last year. That initiative was launched to recognize healthcare aides who are health and safety champions in their facilities or communities. Last year, we were able to sponsor 4 healthcare aides to attend the 2023 Hearts and Hands Conference in Kelowna, BC. It's a conference that was originally started by WorkSafe BC, and Safe Care BC, our partner in BC, took it over a few years ago. And we were fortunate to send 4 healthcare aides to attend that conference. This year, we will be launching the Healthcare Aid Health and Safety Star program once again on June 1st, and we'll be accepting nominations through to the end of August. We're planning to send approximately 3 winners who will be randomly selected based on the eligible nominations received to attend this year's Hearts and Hands Conference that will be held in early October. Upcoming communications will be provided to share more information on that initiative in the coming newsletters. The newsletters at the beginning of June. So stay tuned for more information on that. And on to programs.
So again, in 2024, our commitment to safety and well-being is going to be unwavering as we focus on advancing our safety leadership program. Also, we strive to foster that psychological health and safety with our BARB tools and as well as the Working Mind programs throughout the province. Our dedication again to musculoskeletal injury prevention will remain a top priority. Injuries that we do have, and we'll focus on promoting healthy work practices to prevent injuries. Additionally, we'll continue to prioritize infection prevention and control with our new respiratory fit tester training that we have implemented. And with the introduction of our member assistance program, CCSA can support organizations in enhancing health, safety, and wellness by utilizing our skilled health and safety consultants. For those seeking program enhancement, the member assistance program will that is provided free for our members. It will allow you to collaborate with the CCSA to pinpoint areas of improvement and create an action plan. Excited to say, coming soon, the ability management program. It's shifting focus to workers' abilities rather than disabilities, further reinforcing the psychological safety in the workplace, and it offers a range of services, including coaching strategies, modified duty examples, and training. It is designed to guide employers who may not have a program or need help to enhance their program, and will provide resources that will assist managers, supervisors, and workers to look outside of the box and brainstorm those ideas for modified work. As we look ahead to 2024, we're committed to creating a safe, supportive, and thriving work environment for all, supporting our members to take care while giving care. We continue to launch programs that are packed with resources, tools, education, and training specifically designed for industry and developed in collaboration with key partners and experts.
So that wraps up our association update. But before we move on to the last business item, and we circle back to the financial report motion that I forgot to do back when Kieran and Rochelle were here. I'd just like to congratulate and thank the entire CCSA team on a very successful 2023. I'm really grateful to be on this journey with the team, and I'm excited to see what we'll accomplish in collaboration with our members and key partners this year. So I just want to send out a huge thank you to Leanne and Amy, to Jeffrey, to Natalia, to Marjorie, James Davis, Faye, Christy Lee, Kevin, and James Harris.